It's a pleasure to be here today with you and to discuss reverse burnout. Now, let me ask you this. Burnout is a very, very hot topic for all of us these days, not only for in regards to the patients that we treat, but also within our own community of physicians as well. So how many of you are in training, meaning med school? Okay, how many of you are in residency training? How many of you are fellows? How many of you are full-fledged physicians, practicing physicians? Okay, fantastic. So we're going to hopefully be able to discuss some of this. In my case, I'm a board-certified psychiatrist. I've been a physician for 25 years now. And I've been fascinated with health and wellness pretty much over the past 15 years. So much of the work that I've done has revolved around health and wellness with a particular take on leading under pressure, mood and anxiety disorders. So this is going to be some of what we're going to base our talk today. I always talk about helping people who help people who help people. I think physicians have this big mission, and the more that we are within our practice or that we're within our profession, the more that we're going to continue to guide our fellow physicians as well as other people that are going to have tremendous impact upon healthcare decision-making as well as direct care. So think about, this is one of the things that we usually do as physicians on a regular basis. Now, we're going to talk about first having a self-assessment, then trying to look at the problem, and then trying to look at the solution. So in the self-assessment, I want to relate this. I prepared a burnout quiz, actually, for my book, Leading Under Pressure. And a good friend of mine, who is also editor-in-chief for Harvard Mental Health Letter, said, well, is there any other kind of real leadership? Like, the only way that we can really lead is if we are under pressure. So most of my work has been based on that. This is a sample of what the book looks like. So later on, the Wall Street Journal was preparing an article, actually, on CEO burnout, and they asked if we could prepare a mini quiz based on my longer quiz from the book. And this is where the mini burnout quiz came from. I prepared it for the Wall Street Journal. So, I know most of you have been usually asked to bring all your cell phones away, but I want you to pull them out if you can while you're eating. So you're going to be multitasking now. But try to see if you can bring your, your cell out. Go to burnoutquiz.com, and you can do that test directly live. We're going to try to look at the results. And if you don't have your how many of you don't have your cell phone with you? So if you don't have your cell phone with you, if you have pencil and paper or some kind of trying to figure out what you would score on this test, do that as well so that we can work on that as we go. So this is what the test looks like. So it's 10 questions where we would rate whether we strongly disagree, neutral, agree, or strongly agree with each one of the questions. Ready? Yeah? Okay, question number 1. I have medical problems because of the excessive stress I experience, tension, headaches, anxiety, depression, heart problems, or gastrointestinal problems. If you strongly disagree, rate 1. If you disagree, it's 2. Neutral, 3. Agree, 4. Strongly agree, 5. Everybody ready? Yeah? Okay, let's go on to the next one. I have increased my alcohol drinking at night to unwind from a stressful day. I'm not talking about you, I'm just talking about patients here, okay? So if you strongly disagree, press 1. If you disagree, go 2. Neutral, 3. Agree, 4. Strongly agree, 5. Question number 3. I get easily annoyed with my friends and family when I come back home because of the stress I have at work. Okay? You strongly disagree, 1, disagree, 2, neutral, 3, agree, 4, strongly agree, 5. Number 4, I have been stressed out for the past 6 months. Strongly disagree, 1, disagree, 2, neutral, 3, agree, 4, strongly agree, 5. Question number 6. Excuse me. Number 5. I give all my energy to my work and I have no energy left in the evenings and over the weekend. Okay? Rate yourself there too. Number 6. I feel my job security is threatened. Ready? Number 7. The thought of going to work every day stresses me out. Okay? Number 8. I am stressed out all the time. Number 9. I have been to the emergency room thinking I was having a heart attack and was told I had a panic attack instead. Number 10. I take sleeping pills or over-the-counter or prescribed to sleep at night. And now, press for the score. If you got 0 to 16, you're showing occasional signs of stress but appear to be coping well with job pressure. From 17 to 33, you're managing stress well, but you occasionally stress out. You can still revert to a healthy state. 34 to 50, you may be at serious risk of burnout if you aren't burnt out already. In addition to regular exercise, meals, rest, and relaxation, consider seeking help to improve your health and your performance at work. So, how many of you scored from 0 to 16? Okay. How many of you scored from 17 to 33? Okay. How about burnout? Wow, okay, so this is fantastic. I think it's great to try to figure out where we stand so that we can start to do something about this. And this is one of the most common issues that I usually find. We are not able to recognize, we just go, go, go. And usually what we also find is people don't get sick during the time that they need to bring out a lot of their energy. They do get sick after that happens. So we don't allow ourselves to get sick at all. But at the same time, it's usually helpful to try to fight stress in better ways so that we can be more resilient. So, what's the problem? We're going to go through each one of these points. So the first point is I have medical problems because of the excessive stress I experience, okay? And if we look at stress and the impact of stress, we really have it within each and every system. So if we go into the neuropsych part, we may have more migraine headaches, we may have more tension headaches, back pain, anything that relates to pain, and even stroke. In psychiatric, in the psychiatric world, we may have more of issues around depression or anxiety, or even panic attacks. In the endocrine system, we have exacerbations of any problems that have to do with thyroid issues, diabetes, and any other kind of endocrine disease as well. Gastrointestinal issues, colitis, we have IBS, we have irritable, we also have Crohn's disease, and anything that may also have a stress component within the GI world. Cardiovascular disease relates a lot to hypertension, angina, myocardial infarct, and a lot of the erectile dysfunction that we're just putting in the sexual world has a lot to do with the vascularization and how we're doing within that cardiovascular system too. So immune suppression, it's not uncommon for people to get sick during these tremendous times of stress as well, and anyone with a chronic condition, including diabetes type 2 or asthma, may have an exacerbation during times of stress. Okay, so this is hopefully helpful not only to you as physicians, but also in trying to identify issues for the people that we treat. Now, if we look at the way that we spend money on pharmaceutical products, if we look at the conditions where all these expenses go the most, you have hypothyroidism is probably number 1, with Synthroid, cholesterol, asthma, GI issues, asthma again, diabetes type 2, ADHD. Okay, so interestingly, a lot of what we're treating with number 1 drugs within our system have a lot to do with how we can or cannot manage stress. So this is where I think it becomes kind of interesting. Now, I have increased my alcohol drinking at night to unwind from a stressful day. This is not uncommon, and there are several studies. This just aggregates a lot of the information, but people basically with more than 55 hours of work per week may also have not only a higher incidence of coronary artery disease, but also stroke, and they may tend to drink more as well. Now, let's go to getting easily annoyed with friends and family when we come back home, okay? Now, stress is the buzzword of the 21st century. We're so used to using the word stress in everything that we do. We even have kids saying, I'm so stressed out. And you can understand why they are stressed out. Once they come home from school, they continue to work because they're already getting prepared for college by age 10. You probably started looking into ways in which you could improve or increase your AP courses while you were still in high school, and then thinking about getting into a very competitive med school and then into residency programs. We're probably a very resilient group overall. That's not the norm, but at the same time that resiliency may come at a cost. So it's interesting and important for us to identify this as well. Now, in the stress cycle, one of the most interesting problems that I find with patients who come to see me, or very resilient folks that come to see me, is that they expect for their stress to go away when they go to bed. They're stressed out the whole day, and then they think that they're going to relax like a baby and sleep like a baby when they've been stressed out all day long. It doesn't work that way. Basically, the stress you carry over the course of the day, you will carry over the course of the night, unless you are able to implement some other ways of just relaxing a little bit more so that then you can relax and go to bed. Relaxation is very important before you go to bed. If you're tense like this after taking 10 coffee cups a day, it's going to be impossible for you to get a good night's sleep. So, keep this into consideration. Now, I've been stressed out for the past 6 months. This is very interesting in our medical community. So acute stress is just one event of stress, right? Chronic stress is up and down, up and down. But in reality, what we tend to see is that periodic stress here, occasional stress going up and down in different, frequencies or with a different kind of intensity. But what usually happens for us as physicians is this cumulative part. It's not like you think that after you finish med school, it's going to be a breeze when you go to residency. Well, guess what? You will get more and more responsibility when you get to be a resident. And then guess what? When you do become an attending, you do get to have even more responsibility. And then as an attending physician who may be managing other physicians, you're going to get even more responsibility. So basically what we see in our group is pretty much this. This is also what we see with executives who work in big companies. After they finish their work on an individual level, they get busier and busier, they get more and more responsibility. Our plate never, gets to be free so that we can just enjoy our new position. Basically, all of that comes with more work, okay? The next point is, I give all my energy to my work and I have no energy left in the evenings and over the weekend. So, if we lived in an ideal world, we would probably work about 8 hours a day, we would have 8 hours of recreational activities, and then we would sleep about 8 hours a day, right? But how many of you live in this world? Basically, for busy people, life-work balance is really a myth. Our life looks a little bit more like this, right? We're busy, 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 and then when we get too busy, what happens is we will take away time from our pleasurable activities, and we will be busier then. And then once we have all of that within our work time, then we're going to start to sleep less. And this is what most of us do through our medical career. I graduated when I was 24. I'm 51 now, so that's why I've been a physician for so many years. And that may not be a big deal, but I graduated with a 2 and a 1-year-old. So I had 2 little ones when I graduated. How did I do that? I did this. Basically, I didn't sleep, or I slept very little so that I could be able to juggle it all. So this is not uncommon in very many people who have been quite successful in kind of getting it all and putting it all together. So, now in terms of job security and having it threatened, how many of you feel that way? Okay, so for us, unless we have a definite problem with our performance, there's really not that much of a big deal with job security. As physicians, we're usually safe in terms of finding a place. That doesn't mean that we're going to have it easy, okay? So in general, I would say that most of our work is hard work in general. But, in terms of job security, these are usually the most secure positions, being a registered nurse, air traffic controller, a lobbyist, public school teacher, government accountant, college professor, or federal judge. But for us as physicians in general, again, unless there are some performance issues or productivity issues, in general, I think we tend to do quite well. Now, the thought of going to work every day stresses me out. Now this is very interesting, particularly in some of the works we do. I trained in an inner city hospital in the DC area with very, very sick people. I worked in the ER as well. I honestly got the sickest of people that we could get. So that was fantastic for training because it allowed me to, to kind of see any case without any apprehension. But at the same time, if you ask me now, would you like to work in an inner city place where someone is about to come and kill you, from behind, and you need great staff to protect you and support you so that you can do everything? I'm like, I've done that already. Do I want to do that again? Okay, it's like for some of you who may be in surgical training, do you mind, being awake every single night for 4 years? Maybe you love it, but you may love it now, but as you continue to age, you may want to have a good night's sleep too. Okay, so this is really interesting in that respect, and we're not alone. There's many other folks who kind of dread to go, to go to work, or who do feel that their work overall is very stressful. And there are some positions that are quite stressful to begin with. Being a physician is one of them. Being a firefighter is one of them too. Being a police officer is one of those too, okay? More so if you work in the ER or in some kind of acute setting capacity. Now, what happens if we're stressed out all the time? A little bit of stress is great. A little bit of stress is what I think makes us quite resilient. I've seen many people who have a nightmare before a big exam. They think that they're still in high school and that they have not finished their school, and they're struggling. And then they realize, I'm already in med school, I'm safe, okay? So it's not uncommon for people who are quite resilient and who are quite good at what they do to have a little bit of anxiety, to have a little bit of stress. Stress is good in that sense. A little bit of it is really great. Now the problem is if we have too much of it, that we're on the verge of burnout, that is where the problem is. Because oftentimes when we get to that point where we are already ill, where we are already sick, it becomes more difficult to then kind of needing to reverse what's going on. So, one of the big things that I usually try to work with people that I either coach or that I help as a doctor is, as an entrepreneur, we would spend most of our time creating, as a manager, organizing, as a technician, doing. But basically, when we're so busy, how much time do we just spend vegging, just doing nothing at times? And it becomes quite difficult at times, okay? So think about that. Think about how you can bring in some nice time for yourselves and your families. Number 9, I have been to the emergency room thinking I was having a heart attack and was told I had a panic attack instead. Now, interestingly, we used to tell, I've seen, most of these patients have come to see me because many of you have referred them to the psychiatrist, right? Now, at the same time, it is interesting. There is a correlation with heart disease and people with panic disorder as well. It may come over time, and maybe panic disorder may be just an early flag that something may be coming along the way. So although when you do the EKG and when you do any other test that relates to the heart seems to be normal, watch out, because over time that may not be the case. So there may be other protecting ways for the person to not show full-blown heart disease at that time, but panic disorder may be a flag. So keep that in mind. This was new information for me too. So I thought of it as interesting. Now, I take sleeping pills or over-the-counter or prescribed to sleep at night. So there are so many people with sleep disorders. I'm sure you're seeing them all in your practice. It doesn't matter if you're a primary care physician, whatever your specialty is, or if you're a surgeon, you're seeing these people all the time. You may be struggling with sleep too, okay? So it is not uncommon to have sleep issues, and there is a correlation with heart disease as well as problems having stroke when we lack sleep. So sleep becomes a very important neurovegetative factor for health and wellness overall. Now, what happens with this? Many people who feel so stressed out, who can't sleep at night, will come into this cycle. They take stimulants during the day to stay awake, and then they need to take hypnotics at night to fall asleep. So what happens is the most common stimulants we take include coffee. So unless you're drinking 1 coffee per day, if you're ingesting more than 1 cup of coffee a day, it's just because you need more of the energy. You're already in this cycle where you're using more stimulants. Coffee gives you tense energy, so you can't relax. And when you can't relax, then you're going to need to take some of these hypnotics at night, the most common of them being alcohol, right? So those are the acceptable ones. You can have, I've seen some folks who were cranking cocaine like crazy, and it's very difficult to undo what cocaine does to our brain. So it's very difficult for someone, for example, I've inherited several patients who were on high doses of stimulants for ADHD, adult ADHD, and basically they could not relax, or sometimes they wanted to work even more hours. I've had people who worked a full night because they were conducting business with Asia, and then they wanted to work a second night so that they could conduct more business. We have to be careful that we are not going to screw up our own system, okay? We could do that one time every blue moon, but we can't operate in this mode all the time. So a few years back, they interviewed me for this Time article about popping smart pills. And you have everybody is trying to do this. Basically, you have many students have been studying on stimulants. Unfortunately, I've been asked to give stimulants to students who were working 20-hour days and who were already on patches of stimulants. They were taking oral stimulants, and the mom may have come with her students because they wanted more. And I'm like, this poor kid is just going to die of a heart attack. So we have to be careful. And I know, I don't mean to say this, but basically, as in the medical profession, we're pretty responsible for some of these things. And unfortunately, some of my colleagues have continued to increase doses that are way beyond what we would recommend. And that makes a big mess for all of us, not only for me as a psychiatrist when I try to bring in some common sense to practice, but to you also as physicians who may see those same people when they come to you in the ER or for regular treatment, okay? So basically what you also have is fighter pilots, may have used enhanced alertness stimulants. You have people using modafinil or other kinds of stimulants. You have, it's not uncommon for us to use propranolol to make sure that people don't feel anxious. So instead of giving Xanax, we can give propranolol. It may work better for, for people who have anxiety whenever they give a presentation. So it is interesting that our society continues to push a lot for this. Maximize your performance and productivity beyond your own capacity. But in my mind, my real concern is that by pushing all of this, the norm becomes the stimulant. So I think that that's where it becomes really interesting and challenging for us to say, well, am I doing more harm than good when I do some of these things? And that's where it becomes tricky. So I think, this is a time for us to figure things out and think a little bit beyond. So now I want to shift gears a little bit and give you a little bit of a snapshot of what happened in my own career as I was looking into all of this. So back in February of 2015, that is exactly last year, I turned 50. And so I had my whole family visiting. And as you can see, so this is my husband, this is my mom, this is my dad, this is my daughter, this is my brother, his partner, my son, his wife, and here's me. Now, a little while later, right after this gathering in March of 2015, my dad, like right a week after we met, had acute pain in the back, and when we did all his PET scans and everything, what we found was that he had metastatic cancer. The original one had been a melanoma of 25 years ago, and basically what we found was mets everywhere. So by everywhere, I mean bone, lung, and liver. So here you have, let me see. So here you have some, this is in the lung. Here you have T9. Here you have, let me see. You have, this is liver, the 3 or 4 liver lesions. A big one in sternum, T9, again, right ilium. So there were several ones. And basically, as we were looking into all this, these are some of the ones that he had. So you have L3 there, T9, there was one in T1. And this is a year ago, okay? And what worried him a little bit more at the time was that there were some calcifications, I don't know if you can see them well, here in the heart. So he had had a stent about 3 years before, and he was a bit more worried about that, although the rest of the scan didn't look any good, as you could see. As I was chatting with someone, I related the fact that he was eating like a lion, and when they asked me, well, what is he eating? I said, well, he's eating everything. He's eating meat, fish, cheese, yogurt. He's eating everything. And then this person said, well, don't you know that what he's eating may be feeding into the cancer? And, you know, I didn't know. She was like, haven't you read the China study? How many of you have read the China study? One shy hand here. One. Okay, perfect. Okay. How many of you have followed what you read in the China study? Okay. This is good. I love this. Okay. So, because I'm lazy, I ordered the China study, and at the same time, I really wanted to take a look at what, at what that related to, and I found Forks Over Knives. It's a I call it a documentary. It's a movie, but I call it a documentary. How many of you have seen Forks Over Knives? Okay, so more people have seen Forks Over Knives. How many of you have followed Forks Over Knives? One, good, okay. Two, and you have a third one there. Okay, so if you look at the triad, you have to look at the China study, Forks Over Knives, and Prevent and Reverse Heart Disease. Dr. Esselstyn has been at Cleveland Clinic in Ohio for about 50 years. He based a lot of his original work in doing bypass surgeries for the heart. He was also very involved in breast cancer, tons of things. So I really became curious. I'm very curious. Always a big learner, been in medicine for a long time. I love to learn. So I got into all of this. And as I was researching all of this, we also found this. How many of you have seen this clip? Okay.
You know, I was probably in the last generation of Americans where people widely thought a fat baby was a healthy baby. And I lived with my grandparents until I was 4. They just stuffed me. And so I always battled my weight.
When I was your age, I was heavier than any person in this audience, any young person. I was always sort of overweight. And then when I was 13, I was 5'8", weighed 185 pounds. When I was 15, I was 5'10" and weighed 210 pounds.
You loved all Southern foods.
Oh my God, I do. I love it all.
Barbecues,
Barbecue,
pie,
pie.
and famously a Big Mac.
I like it all. I love all that stuff. And inside, my heart and the arteries that lead to it were getting worse and worse and worse. Because I exercised a lot, but I ate the wrong things.
The president underwent a quadruple bypass operation. Since then, he says he's dropped 15 pounds and gained a new appreciation of the country's obesity epidemic.
Under the brush with death I had maybe had the biggest impact of all, going through the health problems I did. But what happened to me is now systematically happening to a younger generation of people.
If present trends continue, this generation of young people could be the first to have shorter life expectancies than their parents.
How did you lose so much weight? What kind of diet did you do?
Amazing. The short answer is I went on essentially a plant-based diet. I live on beans, legumes, vegetables, fruit. I drink a protein supplement every morning, no dairy. I drink almond milk mixed in with fruit and a protein powder, so I get the protein for the day when I start the day out. And it changed my whole metabolism, and I lost 24 pounds, and I got back to basically what I weighed in high school. But I did it for a different reason. I mean, I wanted to lose a little weight, but I didn't dream this would happen. I did it because after I had this stent put in, I realized that even though it happens quite often that after you have bypasses, you lose the veins because they're thinner and weaker than arteries. The truth is that it clogged up, which means that the cholesterol was still causing buildup in my vein that was part of my bypass. And thank God I could take the stents. I don't want it to happen again. So I did all this research, and I saw that 82% of the people since 1986 who have gone on a plant-based, no dairy, no meat of any kind, no chicken, turkey. I eat very little fish. Once in a while I'll have a little fish, not often. If you can do it, 82% of the people who've done that have begun to heal themselves. Their arterial blockage cleans up, the calcium deposit around their heart breaks up. This movement has been led by a doctor named Caldwell Esselstyn at the Cleveland Clinic, Dean Ornish in Minoa in California, the doctors Campbell, father and son, who wrote the China study, and a handful of others. But we now have 25 years of evidence. And so I thought, well, since I need to lose a little weight for Chelsea's wedding, I'll become part of this experiment. I'll see if I can be one of those that can have a self-clearing mechanism. We'll see.
I hope you're healthy for many years and get to see grandchildren for many years.
Me too.
Okay. Interesting, isn't it? I was like scratching my head going like, how come I didn't know this? And again, I'm curious. So, and then I rationalized, well, maybe I'm not a cardiologist, or I'm not an oncologist. But at the same time, that's our being able to rationalize about some of these things. So anyways, if you look at some of these diseases of affluence, you're going to have that many of them do relate to coronary artery disease. Now, you could argue, well, we've always eaten meat and everything. Yeah, but we're eating steak every day. And, my husband is from Argentina. We have an Argentine grill at home. So it's not like people would go like, oh, well, but you've always been very health conscious. I was like, yeah, but we did have Argentine asado, So it wasn't easy for us. So once you start looking into all the data, it becomes more and more interesting. As you see, what really struck me as a psychiatrist maybe was that President Clinton had to do the research himself, which meant his physicians were not telling him about this. Okay? So the point is, if we don't know, we can't tell other people, or at least be curious about it, and let's learn a little bit more about this. So the people that Clinton mentioned were Dr. Campbell, who's the author of the China study, and Dr. Esselstyn, who's the author of Prevention and Reverse Heart Disease. So if you look at this, it's interesting. If you look at those diseases of affluence, when we have a lot of food that we overeat, those are the problems we have. If we look at the number of deaths for leading causes of death in the United States as well, the ones that I've highlighted in red are some that could relate to nutrition. So basically what you have is huge issues around cancer or cardiovascular disease may be related to nutrition. And you could also question whether or not suicide rates, for example, could be related to a lot of anxiety and depression as well. So here we went on our quest to meet with everybody. We met with Dr. Esselstyn. So this is my husband on the right. That's me, as you can tell. So we're like, well, we really want to learn from these people directly, wanting to make sure, are we missing something? Is this for real? And it was one of the things that struck us. This is us at Cleveland Clinic, actually, in Ohio. One of the things that struck us is that their whole families are eating this same kind of plant-based nutrition diet. So it's not just them. They really want, there's nothing more important and significant for us than to want our own tribe to survive beyond time, right? You would never give venom or poison to your own family, right? So this is one of the things that really struck us. Now, what Esselstyn found is that after just a couple of weeks, 2 or 3 weeks after the diet, like on a PET scan here, where there was some kind of minor occlusion, it opens up. So you have, on average, a drop of even 30 points of cholesterol within 2 weeks of being on the diet. I don't think any statin does that. So at least consider it. Now, this other kind of occlusion that you see here, repaired, he doesn't know when, because the next scan was done about 3 years after the first one. So it was interesting. This was without a stent. This person could not get a stent or could not get bypass surgery. You're going to see that in the movie, if you'd like to watch the movie. Now, we also decided to meet Dr. Campbell, and we did. Amazing man. He's been doing this research for a long time. Basically, what he found is that although many of us may have some gene markers for cancer, different kinds of marker, different kinds of cardiovascular disease, what apparently happens is that whenever we ingest animal protein, the vascular system tends to not be as intact as it should be. And that's where you start to have, among other things, specific deposits of cholesterol and some other things going through, damaging everything and making the cancer to be more able to promote itself. So although the nutritional part may not have that much of an impact on the initiation part, this is where we may have a lot of the genetic predisposition in place. The promotion of the cancer has a lot to do with that nutritional component. And this is actually Campbell's life work. So his findings suggest that at all stages of tumor development, the protein effect is dramatic, operating on all levels, and that the chemical carcinogens only become cancerous and produce tumors if we're eating the wrong kind of diet. This is very, very significant. If you compare what happened in China or in the United States, basically you ingest more calories when you eat plant-based, but there's a main difference in the total amount of fat that you ingest, much less fat in those of us who have just plant-based. Tons of dietary fiber for us. This is one of the main reasons why we may really minimize our danger for colon cancer, for example. Total protein is about 2/3 of what you would ingest when you eat a lot of meat, eggs, milk, or their derivative products. And the percentage of animal protein is really very little, very tiny. Like even if you have, a slice of fish every once in a while, that's what would happen. Now, I'm not going to go into a lot of the detail, but if you look at the correlation, there is more heart disease whenever we eat more refined, processed food. The more of the greens we eat, the better off we're going to be. Look at some of the cancer incidence worldwide as well. Okay? So we could argue in some instances that it could be genetically predisposed, but at the same time you're like, well, we're an interesting melting pot here. So we have people from all over the place. So how much does that genetic predisposition have anything to do with the incidence of cancer? So basically the main distinctions are that when you eat, I'm going to focus just on the plant-based food here, you normalize cholesterol levels, you protect the heart and brain, you protect the integrity of bones, you protect against diabetes. The reason for protecting bone is that you don't have an acidic medium that constantly releases calcium. So this is how you really prevent osteoporosis. You normalize hormone production, you normalize rate of cell division, you protect against Alzheimer's, kidney disease. Anyone on paleo? Anyone had kidney stones on paleo diets? Okay, so this is one of the main reasons why that happens on paleo, and it does not happen when you do plant-based. So if we look again at the 10 top medications prescribed, instead of looking at them just as being stress-related, I really wondered, does this have anything to do with stress? Or, does it have anything to do with just the diet in a way? So, going back to this, most people ask, where do you get your protein from? Well, plants do have protein, and we're over-ingesting animal protein anyways. So I've been on this plant-based nutrition program for about 7 months, and my blood protein level is normal. My cholesterol is 122, and I'm 51, off meds. I've never been on meds anyways, but it's kind of interesting. So the amount of protein, bless you, is kind of equivalent when you are plant-based anyways. But if you start looking at many of the vitamins you get tons more when you're plant-based. And one of the most significant factors is also being on whole wheat or whole grain foods as well. So, this is one of the most important concepts when we look into this. Basically, for example, in my case, I eat everything that has to do with the green area and the yellow area. I just exclude everything that's on the red area. So I eat all kinds of plants, and then I do eat pasta, bread, pizza. It's just all plant-based. So I make sure that there's no eggs or milk in what I eat, and I just, eat as much as I want. So this is not a restrictive kind of nutrition. So Dr. Esselstyn says that this diet gives you no mortality, that there's no morbidity, and that the benefits improve over time. So which I said, well, the diet doesn't kill you, the diet doesn't make you ill, and you become healthier over time, which becomes quite interesting. So what is this about? Basically, we eat plants, all kinds of plants, whole fruits, whole veggies, whole grains, whole legumes. If you have cardiovascular disease, Dr. Esselstyn is super strict. He avoids avocados, nuts, oils, salt, and caffeine. Okay? Basically because they have a lot of fat. We basically eat about 80% of carbohydrates, 10% of protein, and 10% of fat. And again, blood-wise, you know, whenever I've checked any of my patients, their blood protein levels are normal. Albumin level, normal. Okay? Vitamins, okay, so the only way we get vitamin B12 is from bacteria. And we kind of overclean most of what we eat anyways. We tend to get it from animals because animals do eat from the soil, from the dirty soil. So basically, we just check vitamin B12, and if there is a deficiency, we may add that to our program. There's a lot of vitamin D deficiency these days. Best way to get vitamin D is through the sun. And we just don't eat anything that has to do with animal protein. Basically, this is what Clinton said. So one of the important things is learning how to read labels. And believe me, once you start reading the ingredients, you're going to see milk and eggs everywhere. I actually cheated on the diet about a month ago. I had 2 Toblerone bars kept for months, and I was like, I'm going to eat them. I ate a full one day, a full one the next day. So the following day, I had a rash. I was like, can't be, you know, full rash, and I also had some joint pains, which I tended to have before. You know, never diagnosed with anything, but I was like, wow, this is interesting. It came very, very fast. So Toblerone the bars have milk and eggs. I was like, why would they add eggs to chocolate? But basically, I'm not sure where the allergy came from, but you know, every once in a while, if I cheat, I then regret it a little bit. So there's a lot about that. There's, by the way, I have, you know, if you're interested, I have the card that describes all this. So if you're interested, you know, we can, you're welcome to have them. These are the references, so I would say check them out. Another interesting study with Dr. Barnard, who chairs the Physicians Committee for Responsible Medicine, is he tried a plant-based diet on workers at Geico. And this was an interesting study where he included people with diabetes type 2, and they were somewhat overweight. So basically, most of the participants experienced overall productivity improved. Productivity, and they felt a lot better with less anxiety, less depression. The nicest thing about all the effects is you see them fast. Within a week or 2, you start feeling different. You won't need coffee to continue to go about your day. That's part of the very, very interesting part about this. So basically, they lost on average about 10 pounds. The loss of weight is fast. I have people that I know, family, friends, patients, who've lost about 30 pounds in 2 months. Okay? And so there's different ways of doing the diet. Sometimes you can start slowly, sometimes you can go cold turkey. So by the end of the day, my big question is stress the cause, or is it more of a consequence of poor nutrition? You know, it's a big question. Basically, it all looks like all of this is related to stress, but you know, it could also be somewhat related to poor nutrition. So why not think about that too? So for this, you know, I have an algorithm of living with love. And lifestyle becomes a very significant part. So I usually work with my patients or my clients, if I'm coaching them, to improve, achieve, and maintain a goal. And there's a way of doing it slower, there's a way of doing this faster, but basically in terms of lifestyle, I would put nutrition first. If we're eating well, if we're starting our day with good nutrition, then we will have more energy to exercise. Then we will hopefully be able to relax a bit better, and we will be able to sleep a lot better too. So not only will you find an increased level of productivity, but your overall day will be a lot better with less stress. Organizational skills in our lives, a must. There's no way we can survive as physicians if we're not able to prioritize, select, organize, manage, you know, and plan ahead. By the end of the day, it also becomes a lot of the values. You know, what do we really want for ourselves and our families? So in my case, you know, I really feel as if my tribe, in a way, is your tribe as well. So for me, it's more of an issue about inspiring as many people to at least be curious. Check for yourself. Don't take my word for granted. Just check for yourself. And then make your own decision about what you think would be helpful for yourselves. By the end of the day, we all want to enjoy, life, and we all want to spread a little bit of that joy as well, so that we can really target to and aspire to be operating on that well-being area as much as we can. So for me, family is super important. I'm of Italian descent, and it's been really, really very significant and important to make sure that all of us can be as healthy and well as we possibly can. So we can prevent and reverse heart disease like Dr. Esselstyn says about the heart. How about preventing and reversing burnout too? Why not? So thank you very much. I don't know do you have any questions, comments?
How's your dad?
Dad?
Good.
Yep, hanging in there. By the way, I'm going to add, so in his case, he's been on this diet for 7 months. He's also on monoclonal antibody, Keytruda, which works beautifully, as you probably know, and CyberKnife or radiation therapy as well. But he really feels that the nutritional part did a lot for him from a quality of life perspective. He was on, without going into he doesn't mind this. But he was on 7 meds before all of this happened a year ago for high blood pressure, cholesterol, 7 meds, and he's not taking any of those now. So, pretty good. Yes?
Nice seeing you again, Gabriella.
Thank you.
It was great seeing you. My regards to Dr. Locatelli.
Thank you.
We miss him. It's interesting as an endocrinologist because there's been a lot of talk about cancer, and we know about heart disease and diabetes, but I think for this audience, this is very timely because even our organization, like the American Diabetes Association, the American Cancer Society, has published some consensus statements on the relationship between obesity, which is, let's face it, is a nutritional issue too. It's not just genetics, and diabetes and the high prevalence of cancers and obesity and diabetes. So, and one of the things, the messages to my patients is not, we're bombarded by commercials on TV about all our diabetes drugs can cause cancer, but it's really not the drugs, it's the conditions that lead to obesity and lead to diabetes. So I agree with that. I work with Dr. Esselstyn. So, he was, so.
No salt, no oil.
As a fellow in the Cleveland Clinic doing endocrinologist, he was I don't know if you know this, but he was our thyroid surgeon and our parathyroid surgeon. So he did all the thyroidectomies and all the parathyroidectomies at the Cleveland Clinic. So we worked very well. So we used to have him for grand rounds. And of course, we were all pumped up to hear about the latest advances of parathyroid surgery. And he would give this kind of lecture to us, and that was 30 years ago, 25 years ago. He really was a believer, and he's always looked very thin, and he's been practicing. So, and we always took it with a grain of salt, and said, well, I don't know.
He was out there.
He was out there a little bit. Why don't you just give him a staff and do something?
Exactly.
He's been putting all this data together for a long time.
Yes.
With Dr. Campbell, and it's interesting to see how this evolves. There's no question that nutrition is so important. Plant-based diet is much healthier.
So the interesting thing is, many people say, well, this is really challenging. Well, it really does get better, just like with any habit. Don't get me wrong, sometimes it's challenging. When we go out to dinner, we have to ask for things that are maybe steamed or baked or boiled, but with no added salt, sugars, or oils. So we do have to try to figure out how to make this happen. At the same time, I would say that there's more and more of this awareness right now, so it becomes a lot easier as well. I also say, to tell you the truth, that this kills the business. Because, for example, in my case, imagine most psychiatrists just are quick to prescribe any kind of med. I'm a pharmacologist by training. I spent years at the NIH, okay? So that is part of my upbringing as a physician, even though I've loved to always do a lot of therapy as well. So I'm one of those old integrative psychiatrists who can offer therapy plus lifestyle plus the pharmacology part. But at the same time, this is where you have the option. So my husband, although he's a physician, and he's a great physician, and he prescribes a lot, and he also, he's an epileptologist, so he also sends people for surgery to take care of that epilepsy focus as well if they need to. But as he says, he would rather stay away from physicians and not take any meds. And most of us would agree, right? So that's where I think the choice comes into play. Now, this doesn't mean that as much as I'm saying this kills the business in a way, I think there's most of you were not doing this kind of nutrition. So as you can see, it's not going to get there anytime soon. But the more that we can be more aware of how it is that our energy kind of goes down the drain, and how we can up our energy in more of a natural way, in a healthy way, so that we can endure and have a lot of energy throughout the course of a week without needing to take anything else, I think that's where it becomes quite interesting. So the other concept that is super interesting, and I didn't even tap into that, is how do you inspire other people to at least be curious? And what I found is that the more that you can position yourselves in a nice position within your tribe, the easier it becomes. Otherwise, you're the only odd, you're that black sheep in the family that people are like, oh my gosh, here they go again. They're going to talk about this again. And that's not uncommon. But the more that you are able to tap into someone who says, let's take at least a look at it. Let's try a challenge. Challenge yourselves to do this for a couple of weeks and see how you feel. Test your own, do a baseline, baseline blood today, and then try the diet, be as strict as you can for a couple of weeks, and then see how you feel, and then see if your cholesterol improves or changes in some shape or form. So over the past few years, for example, I had noticed I was always more on the slim side anyways, although I could eat everything. But I noticed my cholesterol was around 157. And then when I checked again after being on this kind of nutrition, it really dropped to 122. My triglycerides are like 40. So, and the other interesting thing that Dr. Esselstyn found is because he worked with people who were so severely ill from a cardiovascular perspective, he did not even recommend exercise. So I also know many people who are killing themselves at the gym so that they can remain fit. This is a lot easier to do. I walk every day, I do a lot of gardening, I play with my dogs. If you looked at me, you would see I have like muscles, I look like a swimmer. People think I'm a fitness instructor. And people have asked me, are you a fitness instructor? So I'm like, okay, it's interesting of how people do perceive you. And the tons of energy is more of the norm that you see. So all I'm saying is, for me, what was interesting was at least to be curious and check for myself. And if you do have people who are already sick, inspire them to maybe give it a try. You don't have anything to lose. Just make sure that they eat everything. Most people think that they're going to replace meat with lettuce and tomato. You would really die of hunger if that was the case. I mean, it's like you can't really do that. So, if I go back to this, if you look at the nutritional value, let's see if I can show you this. You can only replace, if you're thinking about meat, that's why if you eat a little tiny bit of meat, you will have several calories there. So you can only replace it with pasta, with bread, with whole grains, with something that fills you a lot more. I actually there's several physicians who are very involved with this. Dr. McDougall is super involved from California. His son, Craig McDougall, has been raised this way. Oh, by the way, if you want I have it here if you want to pass them. And so he eats once or twice a day, and he eats like 2 full bowls of pasta, which I wouldn't suggest, actually. I would probably suggest to have a little bit more of a combination of other things. But what I mean by that is just with pasta, grains, and beans, you could probably be okay. You would get all the nutrients you need anyways.
You get more calories.
Exactly.
You can gain a lot of weight.
Yes.
With all those carbs, so it's a balancing act.
But when you don't eat the meat products, You don't. Like, for example, I eat pasta, bread every day. And in my case, my metabolism is quite interesting, so I need to overeat so that I don't lose any more weight. My BMI is 18 or 19. Okay? Plenty of energy, perfect labs, you know, everything's really fine. But I need to, you know, I may eat an extra bowl of pasta. The interesting thing that I've also found with people who are chronically on diets is that for the first time ever, they can eat pasta, they can eat bread, they can eat potatoes. So they love the abundance of the diet. I've met people who've always been overweight. So they've lived on a diet since they were 5 years old, always overweight. And then suddenly, for the first time ever, I had someone come and, you know, she was happy. She had not, her weight didn't change at all in 2 weeks that she was on the diet. And I said, that's weird, like, that's not good. And she was happy. For the first time ever, she had eaten everything she wanted to eat, like pasta and the potatoes and everything. And for her, it was fantastic. She didn't gain any weight or she didn't lose any weight. It was fine because she was able to eat a full plate instead of just those, you know, smaller portions that she was constantly, you know, quantifying her calories with. So that is interesting. And in regards to thyroid issues, we have to immediately watch out for, you know, for thyroid because the needs usually go down. Same thing with diabetes type 2 in terms of their requirements of insulin or any other meds. So that we've seen as well. With high blood pressure as well, you know, blood pressure starts to drop. So you have to make sure that you follow up on people because their blood pressure will normalize quite fast. In my dad's case, it took a couple of months, 2 or 3 months, for him to not need the meds. But again, for high blood pressure, he was taking at least 3 or 4.
I had been on meds for a long time too.
Exactly. And he was a huge meat eater.
Can we get the papers, information?
Oh, yeah.
Thank you. Soy products. Do you use soy products and how did you cut your sugar intake? Or have you cut your sugar intake?
It's best, so this is my, and this is, thank you. So for sugary products, basically, no sugar.
No sugar.
I mean, basically.
Sugar substitute?
And substitutes best not to. If you want to try a little bit of honey or something like that, you could do something like that, or try less of the sugar. This is a main interesting change or difference that I found between Dr. Esselstyn and Campbell and Dr. Ornish, who President Clinton also mentioned. So Dr. Ornish allows more for a spectrum of choices. And he says, well, in moderation, it's okay if you eat some chocolate or if you eat some fish every once in a while. The problem that I have with that as a psychiatrist is that the more that you continue to feed into the addiction of sugars, of salt, of oils, of anything that's really tasty, the more you will want that. It's like with cocaine, or it's the same thing with alcohol. You know, if you have a problem with those things, you really want the abstinence. The more that you have the abstinence, the easier it is. So you can do it every once in a while, and sometimes it's not uncommon for people who are pretty strict on the diet to not feel very well when they eat some of the other things. And again, for me, the way that I came to this was for purely health reasons. Vegans will do this to save the animals. Environmentalists will do this to save the world. I am a self-serving human. Okay? So for me, it was more, let me check on health reasons. Would this be helpful? What is it in it for me? So that's my point in terms of the addictions. And that's why I would suggest to just eliminate them completely. You're going to feel miserable for a couple of weeks because you're going to miss them. But you're going to get used to it. And once you stop using outside sugars, you're going to start tasting the real taste of fruit. And that's when you're going to feel, for example, for me, within a month time, as I was savoring fruits, I was like, did you add any sugar to this? It tasted so sweet because you will start retasting the sweetness of the foods themselves. So it is a transition. A lot of it sounds like it's a diet. And as a psychiatrist, I can tell you, a lot of it is our mindset. So it really comes down to Are we ready for it? It's a behavioral change. How can we make it the easiest for everybody? And it has a lot of that. It's not just the diet. It's how you package, how you put it together, how you sell it in a way, and how you can help people through that program. The other nice thing is it's sustainable. Once the person learns how to do this, they can do it on their own. They really don't need additional help. Anything else?
How is Dr. Locatelli living without caffeine?
So Dr. Lucatelli, and actually you hit it.
Our Cappuccino Club.
He was a founder of the Cappuccino Club here. Okay, and I'm so glad you asked. That's exactly how he found out. So basically he had, his nurses were running after him over the course of the week with his coffee so that he could see the 20 or 25 patients he had, right? And then all of a sudden they were running after him with coffee and he was like, I don't need any coffee, I don't need any coffee. He tells a story that he started the diet to help my dad. But within just a few days, he felt so much better with much more energy, just the clarity, the feeling lighter, not needing the coffee at all, that we only have one coffee in the morning. He doesn't have any more coffee during the day.
I inherited his cappuccino.
You did. So that's how he found out that there was something to this that was beyond. And, you know, again, super meat eater in his case, gaucho from Argentina.
Well, excellent. Thank you.
Thank you.